I'm a senior at Basis Independent Silicon Valley, which is a high school in California. And I think the biggest thing that I enjoyed about everything going on has to be like the more free time that we have. So this is an answer that most people are going to have, but the biggest thing is definitely, especially with college apps that I have right now, I definitely have a lot more free time. But the biggest thing that I would miss is definitely kind of having that communication, that in-person communication with your friends every single day, kind of brings a livelihood to conversations at school. So that's definitely something I miss.
Hi, I'm Daphne. I'm a freshman at Emory University. I mean, I guess for me, like I've kind of missed out on that, first semester college freshman experience, which is kind of a bummer, but I'm grateful that, being at home, I've been able to spend a lot more time with my family.
Hi, I'm Gideon. I'm a freshman at Case Western Reserve University. And I'd say that it's difficult to interact with professors and other students, but it also allows for more time to do work or relax because most of my classes are asynchronous, so I can just work at my own pace.
Hi, I'm Linus from Basis Independent Silicon Valley, and I'm a junior this year. And I'd say that for me, everything moving online, like I really do think that I'm missing out on being able to actually interact in person with teachers because I feel like it's a very important way for me to actually form a good bond with them. But I would say that everything being online is actually okay because I can actually find a way to stay awake in most of my classes now.
My name is Nithya and I go to Cupertino High. For me, I'm enjoying that my school switched to a less packed schedule. We have mostly asynchronous on Wednesdays, and that's been helping me out a lot, and I think a lot of students. But it is hard to get your questions answered easily and efficiently, especially if it's on your own document and you want to give examples or something to your teachers. It's kind of hard to get your questions answered in that way.
I'm Nithya and I'm a sophomore at Basis Independent Silicon Valley, and I really enjoy having the freedom to do my work whenever I want, but at the same time, I don't have that motivation anymore because I don't have that social interaction that we used to look forward to.
I'm Randeep. I'm a junior at Menlo, and for me, like everybody was super like psyching me out about junior year, like it was gonna be the hardest year. But I really think that being online has made it a lot more chill. But with that also comes like it becomes super monotonous, like just getting out of bed and then instantly just hopping on your desk and doing 8 hours of just work on a computer and not moving at all, and then doing a few hours of homework after that. It just made it super boring. So I feel like that's been like the biggest drawback for me.
I'm Sophia. I'm a junior at Menlo School, and I've definitely learned how to be more independent and productive during online school because I think you're definitely expected to do a bit of the learning on your own. And I also get a lot more sleep, but it's unfortunate to not be able to see my friends and classmates on campus every day.
Oh, hi, I'm Chloe. Post-grad graduated in 2019, and now I'm working at the Center for Asian Health Research at Stanford. And one of the things that I like a lot about doing my work remotely is that, when you're hopping from meeting to meeting, you don't have to bike across campus. You can just go from Zoom room to Zoom room. But I think Zoom creates both a super personal and impersonal space for work. For example, like when we're on a Zoom call right now, like I can see all of you in your individual rooms, and it's also personalized, and I can see like little bits of your personality showing through in your decorations. But at the same time, I'm just looking at a screen, and I feel like I'm not getting to know each one of you in the capacity that I would have liked to had we all been meeting in person.
Hi, everyone. My name's Hillary, and I am a postgrad student from Berkeley. I am also a medical school applicant. So for myself this year, I am most worried about students who may have a little bit difficulty with resources this year, whether it be Wi-Fi at home, whether it be intergenerational homes with, 10 people in one household. I worry about those students just because I know that there's an added layer to their education this year, and I feel for them. So I hope that we find better ways to continuously reach out to those students. Thank you.
Right. Carissa.
Hi, everyone. I'm Carissa. I am a senior at the University of Texas at Austin. And it's definitely, I think, something that I've disliked is it's just been disheartening being inside, spending my senior year, not being able to interact with my friends and professors, especially for upper division classwork that I was really looking forward to. And just not having the chance to celebrate, I guess, major milestones of my last senior year along with my peers. So that's been a little frustrating, but I do appreciate, like many of you said, the flexibility of Zoom, being able to go to meetings and office hours for professors readily, as well as having access to like Zoom recordings and virtual notes and stuff like that. So it's made classes a little bit more accessible in a sense, but I do really miss in-person interactions.
Hi everyone, my name is Kyoko. I'm also a senior at Columbia University. And what I have appreciated about online learning, especially this semester, is the unique forms of assessment. For example, I have a lot more creative projects rather than synchronous exams, which take a lot of the pressure off of online learning and the stakes that are present, especially as a senior. But like Carissa was saying, I really miss the engagement that you get with in-person learning. Also, I miss being in a city. I miss being on campus. And I miss seeing my friends. And I think what worries me is the accessibility and longevity of this format and what it means, not only for me as seniors, but as I'm hearing from Daphne and Gideon as freshmen as well, first years.
My name is Mary Khan. I'm a second year medical student at the UC Berkeley UCSF Joint Medical Program. And something that, I mean, I echo a lot of the sentiments that's been shared already. I love that I've been able to be with family, but also it's bittersweet to not be with friends and be in that surrounding um, like ecosystem of just like trying to do everything all at once with your friends who are doing the same thing. But what I do, and also research has been impacted as well. Everything has gone super remote. And so like what Hillary was saying, that like there are people with different access, they won't be able to be a part of that research. And so like we have to be very creative. But what I do like is like that there are some things that are more accessible, like mentorship. Like we were able to invite Dr. Gabiola to an online networking conference for Filipino Americans. So like that reached 500 people. And so I think that's something like a silver lining to this whole thing.
Hi everyone, I'm Francis. Nice to meet you all. I'm a third year med student right now at the Medical College of Wisconsin. For me, I think the thing that comes to mind most immediately in terms of online learning is currently I'm on my family medicine rotation, and you know, like aside from like clinical time, there's also you know, some online teaching like didactics that happen too, such as like you know, where we get a little bit more usually like in-person help with like physical exam techniques and like practice like with motivational interviewing and things like that. And I think that's been kind of challenging, speaking for myself, at least as a kind of a newbie with this sort of stuff. So I think that's something that I kind of sort of miss, having that in-person time to just really like hone my skills and just that time to be physically present with other people. On the other side of it, I'd say that I see how things like Zoom can kind of help us facilitate some forms of connection. Unfortunately, we lost one of my classmates last Sunday um, to you know, it's an epidemic that continues to affect physicians and medical students, but to suicide, unfortunately. So we were able to have a memorial for him and sort of connect with colleagues and his family and stuff, even though they live actually an hour and a half away. So I guess in that sense, like we were able to facilitate that sort of connection despite a lot of the isolation that some of us are experiencing. So that's a positive side of it, I guess. So yeah, thank you.
Yeah, thank you for sharing that, Francis. Yeah, it's really sad, and it really the social isolation and you know, social distancing and not being able to be with your friends is really just very challenging, not only in education but in our day-to-day interaction, right? So, few comments from Stanford Medical students. So this is from Gabriela, who is a second year medical student at Stanford. Um, her commentary, she said, I actually quite like the distance learning modality. Learning from home has allowed me to have more time to study and focus on my research. I have also been able to spend time with my family and loved ones, something that is very hard to do when pursuing medicines. Since I'm not in the clerkship yet, I think the distance learning modality works even better for the reasons I shared about. And more other people who at Stanford, students at Stanford had shared the social isolation is very challenging, especially for the first year students who are starting at Stanford, where they're coming in away from their family with no interaction whatsoever with their classmates because they're forbidden to even form small groups. So there's mandate at Stanford and what they have to comply with, and they have to sign that agreement. So that's very, very isolating for them. And as you know, medical school is probably one of the most rigorous training out there. I couldn't think of anything more rigorous and more sacrifice, like more sacrifice and commitment than medicine. And so I think it is really great that you're able to do self-directed learning, but still maintain that self-care for yourselves and reach out to friends, however that could be on Zoom or going outside, walking, bicycling with your friends with caution, because I think the virus will be here to stay. When, how long, we don't know. When the treatment will be available, we don't know. The vaccine will be available. Would it be safe and would it be effective? We still don't know. So there are things that we don't know, and we have to be remaining flexible. So my next surprise question is, if you were invited to be part of the leadership to design a curriculum and to be able to coexist with this virus and design a curriculum that you think will be effective, what would that be?
Thank you. Good question, Dr. Gabiola. I will say, like, as my perspective as a teaching assistant, we spend a lot of time talking about the best ways that we can be accessible for our students and design our curriculum and examination procedures in a way that is both fair but also understanding of everyone's situation. So if I were to be in that room talking about a universalized curriculum, I would like to definitely be a champion of collaborative work, putting the trust into students to use each other as support, as well as encourage proper collaboration in the fear that a lot of professors and teachers have of cheating, whereas a lot of kids whereas a lot of kids are just trying to help each other out. And I'm of the philosophy, if you're in a difficult situation, whether you're going to medical school or whatever, you will always have people to help you out. You'll never be isolated. You'll never be in a situation like an exam or a test. So I would definitely like to design a curriculum that includes and encourages collaboration, whatever that looks like, Zoom breakout rooms, creating pods if you're on campus with people who live nearby you, etc.
Definitely. I think that's really important. And like you mentioned, another thing that's really important is being there to support the students. Because going forward, if we're to stay online, the students will need help to make sure that they're on track or their mental health is fine. Everything that is happening to the adults is also happening through the students, and in a much more impactful way in some ways.
I just want to echo what Kyoko said about these Zoom breakout rooms and trying to engage the students a little bit more, but also like coming from a student's perspective. Honestly, like if you like put me in front of a computer and made me watch a 70-minute lecture, I'm gonna tune a lot of it out. Not even because like I think it's boring, but because it's like so monotonous to just be sitting at a desk and staring at a screen for 70 minutes. So I think those like Zoom breakout rooms and trying to engage the students a little bit more can like exponentially increase like their engagement in the classroom as well and help them perform better later on.
Right. All right. Sophia?
I would incorporate an asynchronous model whenever possible, and I would also dial down the weight of tests and replace some of them with research projects and group work. I think the reason why is just because it's easy to forget how hard this time is on everyone. And I think making the curriculum a little less rigorous than it would be in person is important to the well-being of the students and the teachers.
Right. Carissa, do you want to go next?
Yeah, I definitely agree with Sophia in that I think when all possible, asynchronous classes I think would be ideal, just because I know a lot of my international friends here at UT have had quite a struggle being able to try to, I guess, adjust to the various time zones to take the synchronous classes. And I don't think my university has been very helpful in that sense. But I think whenever synchronous classes are, I guess, they are mandated, I think the professor or teacher just needs to take more responsibility in making the class as interactive as possible outside of using just breakout rooms. And I can definitely say one professor for me this semester comes to mind where he'll just call on so many students each class and kind of makes it a requirement for everyone to have their cameras on. And I can definitely say that's helped my just retention of the information and engagement as well. And even though the class is an hour and a half long, I'm definitely engaged the whole time, and not so much out of fear of getting called on, but just because he's very interactive and collaborative and makes it more of like a non-judgmental, welcoming space.
Yep, and that's very important. Anyone else? If not, Dr. Gabiola, maybe you have something to add.
I'm in.
Oh, sure.
So I think definitely echoing everyone. I think just leading with empathy and just understanding that this is a hard time and listening to each other, especially professors and like the student body, the medical system, the medical school, listening to the students and what they need. And like a way that I was able to implement that as a graduate student instructor, which is similar to like a TA, because I teach at Berkeley Anatomy, was like to have like these anonymous feedback forms that is open throughout the year so that they could just really like tell us what they need. And that's something that I've also appreciated from my medical school at the JMP, is that they listen to us, especially when Black Lives Matter movement was happening and there's systemic racism that was like happening in our country. Like that, this was really hard for a lot of students of color in our class, and so they made our medical curriculum much more reflective of like just acknowledging the harms that medicine has happened. And so yeah, I think definitely there's a lot to listening to be done, and just have it be like what everyone was saying, a collaborative space, because it's such a new environment. Like this is like coronavirus. It's like everyone doesn't really know what they're doing, and I think just having empathy with everyone and working together to make a solution that works for everyone. I think I'm also very worried about my hands-on like experience with patients in the future, and so I think like definitely that's where feedback can go, because like we know that there's a virus, we can't get sick, but also we need to learn so that we can help our patients. So like just listening to each other and like talking and like making pods, or like what can we do that's still safe within the guidelines to do so that we can get the skills that we need.
Something I just want to add on is that like a lot of the time when some of our teachers, they ask us just in the beginning of the class like a random question like, how are you doing, or like something about you, it still like helps to build that connection you have with your teacher that otherwise is pretty non-existent over Zoom calls.
Yeah, and I appreciate that everyone else is also thinking about ways that we can improve. And it's really important that, like Mary Con was talking about, that we listen to students. I will also note that I'm a huge advocate for universal pass and universal A systems, especially for undergraduate or even high school curriculums, because even in undergraduate curriculums, not all of the students are going to be coming with equitable resources, equitable funds to participate on campus, whether that be getting textbooks, being able to socialize with other students, etc. And that's when we were all on campus with a library, with a quiet place to study, with reliable internet. And so, especially now, since it's a full semester online, I really appreciate professors who are very flexible and transparent about their grading not being the same as previous years, because this is new. COVID's new. You can't expect everyone from all around the world to have the same studying ability or performance as they would if they were at school or in a place where there used to be being academically challenged like this. So I'm a huge proponent of just universal pass, universal A, not pass, D, fail, because that still implies a hierarchy. Just allowing students to be seen as appreciated for their work and their effort during this time, and not things that are out of their control.
Hi, I just wanted to ask, I remember speaking with Dr. Gabiola, she wanted me to touch upon, standardized testing this year. So as we know, many students, whether it be for college, SAT, ACT, the MCAT, LSAT, GRE, all of these large standardized testing institutions had to make decisions about how they would go about testing this year, as well as on the end of the colleges and the universities, medical schools, law schools, et cetera, had to make their decisions as well. And I think that, like, touching upon what a lot of people said, I think that having that collaborative approach and really creating a safe space for feedback and for students to present their concerns, because across the board, speaking on, let's say, the colleagues and peers I have that are in the medical school application cycle, this year for the MCAT alone, students had their tests canceled since April and May, and it was rescheduled multiple times, whether it be them telling you that you have a test next month, and then it's like, oh, sorry, unfortunately, it's moved to the following month. And you can imagine for a student who has been studying for some times rigorously that this, there is data that is showing that unfortunately some students' performance is being affected. And so I'm curious to see how it will be implemented to analyze these results with that in mind, because as we all said, it's so novel that how do we introduce that standard of error into everything, whether it be grading in schools or whether it be these tests that have a lot of weight for a lot of students in admissions. Thank you.
And I think that goes back in a little way to what Kyoko was saying about kind of the teachers understanding that COVID is different, this entire time is different, and that they should be ready to kind of adapt to that in a way.
I really do appreciate all your, feedback and reflection on how COVID-19 had affected your education, and it's so nice to hear your authentic responses. Even in medicine, I'm one of the educators for care faculty at Stanford. Even in medicine, we're still struggling to try to figure out how we could incorporate the laying of the hands part of medicine into the training, right? So we have a space, right? A two-dimensional space where we could show how to examine a patient, but there's really no interaction, no feedback, and no meaningful interaction. So how to make that engaging, meaningful, and up to par with what students expect and still appreciate the incorporation of safety and well-being of our students will be a very challenge to us as educators. So I think all in your input are really welcome, and I would welcome more dialogues such as this on a podcast. So you tell me in the future what else we could do in terms of making this podcast like more reaching out to the people and hearing real stories, real solutions, and practical translation to what we have to cope with. Because I think COVID-19 will be here to stay. And so we have to learn how to coexist with this virus safely and emerge on the other side as more innovative. I think what it taught us is to be more flexible, to be more creative, more collaborative, and more forgiving and accepting. I think this is a challenging time, and it really accentuated the already existing inequity, which was there, but we just see it more now. Thank you so much. Have a wonderful day.